Hello, my name is Yudi, and this is the Yudi Factor, a program that understands that knowledge is power. Therefore, week after week, we discuss issues and we empower you with information to enable you make informed choices, especially when you factor in something you heard on the Yudi Factor into your situation. Today, we'll be talking about kidney, and my guest is Dr. Theophilus Ume Izudike, consultant nephrologist and kidney transplant physician, Lagos State University Teaching Hospital, LASUT. Well, kidney disease is on the rise. How can you help yourself? We'll get to hear all about our kidneys, and that is if you do not go anywhere. We'll see you after this time out. You're welcome back. Doc, thank you for honoring our invitation.
You're welcome.
Yes, consultant nephrologist. Who is a nephrologist?
All right, so a nephrologist is someone who's gone through a postgraduate training. That's after you've obtained your first medical degree, which is about 6 years in Nigeria. And then you go on to do a subspecialization in the area of kidneys, hypertension, and diseases that relate to the urinary tract. So that's the person who is called a nephrologist.
Nephrologist, okay.
And the training takes about 4 to 5 years to complete in Nigeria. In some other parts of the world, maybe 4, 5, or 6 years. You have to have a basic knowledge of the other organ systems of the body.
Okay.
So you would have gone through training in other specialties in medicine, like neurology, dermatology, respiratory medicine, gastroenterology, and all the other ones. And so when you've done that, you then subspecialize to be a kidney doctor.
Transplant physician. You also do transplants too?
Yes, we do offer transplants.
Kidney transplants?
Yes, we do offer
in Nigeria?
Yes, it's available.
Wow. How come people still go to India?
It's something that been asked over and over again.
Yes.
So if we look at the issue of people who are on HIV medications, these became available shortly after the millennium.
Yes.
So it's available and it's free. So government, with collaboration of some donor agencies, is able to provide these drugs free to Nigerians.
Yes.
And so nobody is thinking about going out of the shores of this country to access such drugs or such care. So if we have a situation that the government has been able to come up with a program to be able to provide dialysis free for Nigerians, then they can also look at the aspect of doing transplants for Nigerians. As long as people have to pay out of their pockets, they are at liberty to go anywhere because it's their money they are paying and nobody is offering them help. So that's the reason why people say travel, even though it's available in many, not less than 12 centers in Nigeria.
Really?
But people still travel because they are paying out of pocket and they decide ultimately where they want to have their treatment.
What are the functions that makes the kidney so important that when people come down with kidney disease, it's so life-threatening?
Right, so the kidneys there are two of them in most people. So they are like the shape of beans. If you've seen beans, I'm sure everybody has seen beans before. So they are about the size of your fist, if you make a fist. So each of them is about that size. And they are located in just below the rib cage at the back in most people. So we have people having two kidneys that do several functions. So up to 25% of blood flow from the heart goes to the kidneys. Shows how much blood goes into them. But in as much as they receive that large amount of blood flow, they're able to filter what blood goes through them to such an extent that even though you have over 100 liters of fluid filtered by the kidneys, but at the end of the day, people produce just about 2 liters of urine. So it's a very highly effective organ that is able to filter out the waste products of the body. That's one of the things it does. So it filters out the waste nitrogenous products that the body generates every day. It also helps to regulate body water. So you see people drinking so much water, which is quite good. I encourage my, not necessarily kidney patients who are tending towards dialysis, but people who may have kidney stone or some other kidney conditions, they should take lots of water. everybody healthy. It's part of maintaining your kidney health to make sure you drink at least 2 to 3 liters of water per day, more so in an environment that is quite hot. So that's another function the kidney does. It's able to regulate body water. In as much as you drink, no matter how much you drink, the kidneys excrete the excess and helps you to conserve your body water. It also helps to maintain the pH, acidity, alkalinity of the blood within a narrow limit so that the body doesn't become too acidic for the cells to work or too alkaline for the cells to work. Then it also helps to regulate so many ions like sodium. So if you consume lots of salt, your kidneys are able to excrete them and ensure that in replacement for that, you have potassium. However, when someone consumes too much salt over a long period, then the kidneys may not be able to excrete that sodium load, and so the person may be at risk of developing hypertension. Also, the kidneys help to regulate the bone health. There's a hormone the kidneys elaborate, which is called calcitriol. So that hormone helps to ensure that the calcium that you're taking in your meals is deposited in the bone. When people have kidney disease, this hormone is not there, and so the body tends to take out the calcium from the bones, and so the person who has kidney problem may be at risk of having a fracture, even though they may not necessarily have fallen, or they may just have a little trauma, and they can develop what's called a pathological fracture. Now, the kidneys also regulate the blood, formation of blood, red blood cells in the bone marrow. There's a hormone liberated by the kidneys, which is called erythropoietin, or EPO for short. So when people are on dialysis, they need to be on injections for this so that their blood level doesn't go too low and they will need to be having frequent blood transfusions. So in a nutshell, I think that's about the major functions of the kidneys.
Okay, the kidney, obviously, from all the functions you've enumerated, is so important.
Yeah.
But then why is kidney disease on the rise?
Yeah, so a number of factors will account for that. Number one, taking analgesics, especially the ones that are non-steroidal, ibuprofen, I don't want to mention some names, but diclofenac. Those are very potent analgesics that maybe people in their elderly, because they have arthritis, or women who have frequent menstrual pain, if you keep indulging in these drugs, the person can come down with kidney disease. Also, even drugs that seemingly are safe for ulcer, omeprazole, if people keep consuming it more than what's recommended, they don't go to the doctor for a prescription, they can come down with kidney disease. Some antibiotics may also put people at risk of kidney disease. And then, of course, herbal remedies. And of course, people that tone, we've seen people who've had kidney disease from using some toning creams that contain mercury or some medicated soaps that contain mercury. Also, if people smoke, smoking is not healthy because it puts them at risk of hypertension, which ultimately may damage the kidneys. And then people who have been diagnosed with hypertension, they need to be on treatment. They need to know that treatment is a lifelong treatment. You don't take drugs for hypertension like you do for malaria and stop after a few days. You keep taking your medications. Of course, you see your doctor to know whether the drug is controlling your blood pressure or whether you're having even complications from using the drug. So you need to see your physicians from time to time to be sure that your blood pressure is controlled below 140/90. And then those who have diabetes, they need to also be on medications for the diabetes alongside with lifestyle modification. So that goes a long way in preventing them from developing kidney problem, because those two conditions form the major contributor to people needing long-term dialysis, whether in our environment or outside our environment. And other things that people need to know is that if someone has HIV and they're on treatment, they need to be screened to be sure they don't have kidney problem. If somebody is a sickler who has been a sickler diagnosed from childhood, as they grow older, they may be at risk of kidney problem because of the sickle cell disease. Also, people who have infections like hepatitis B and C. Some women may have some autoimmune diseases in which the body fights itself. So systemic lupus erythematosus, rheumatoid arthritis, systemic sclerosis. Those are some of the conditions that can affect the kidneys on the long run in women. It's commoner in women than men anyway. Yes, so then of course women who are pregnant may also be at risk of pregnancy-induced hypertension. And so after they've delivered, the blood pressure may normalize, but later on in life, they may be at risk of developing hypertension.
People who take or have high blood pressure. Does the medication, would it affect the kidney in any way? Don't answer that question. You'll respond when we come back. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, today we're talking about the kidney, and we have a consultant nephrologist, Dr. Theophilus Ume Izudike, talking to us on how we can take care of our kidneys. Yes, I asked you a question before we went on break.
Right, so...
long-term taking of high blood pressure medicine?
Yes, it depends on the drug.
Okay.
So older drugs have been found to have some deleterious effect on the body, especially the water pills. So I don't want to mention them, but water pill, most lay people would know what water pills is. So it could give complication of making the cholesterol go up. It could affect the elements in their blood, so they may have some reduction in their sodium or potassium, which can give them cramps. So by and large, some people may even develop diabetes from using those water pills for a very long time. So, but more drugs have been developed that don't have those side effects. So more or less, if you're on your drugs and you see your doctor regularly, the doctor should be able to find out if that drug is suitable for you. There's some people that take these water pills that don't have these complications, but by and large, anybody that's been on water pills for more than 5 years should consider changing the drug to more favorable drugs, which are quite affordable, just like the water pills. So yes, you should take your medications, but you should also see your physician so that they'll be able to monitor to be sure you're not developing any complication of either the kidneys or the heart, or even the cholesterol going up, because those are some conditions that can affect people who have high blood pressure.
Could you tell us the earliest warning signs, the basic earliest warning signs that would make a layman suspect? Right,
so kidney disease in its early form usually doesn't have any symptom, just like hypertension and diabetes. So when somebody begins to wake up overnight, quite often to pee, to urinate, or they urinate and they discover that the urine brings lots of foam, or they discover blood in their urine, it's not specific to the kidneys, but it could be a pointer to kidney disease. Or the person develops leg swelling or swelling of the face early in the morning, or the person just discovers that he walks some distance and he gets tired easily, or the person begins to lose appetite or have hiccups or feels like throwing up early in the morning. So these are symptoms that are non-specific. Someone can think, oh, it's malaria they better to have, and they just take anti-malaria and they feel a bit better. But when those symptoms are developing, the person probably has lost over 50% of their kidney function at that stage, when they are having leg swelling of the face or get tired easily. Over 50% of the function of the kidney has been lost. And once the level of overall kidney function gets to about 15%, then the person is needing dialysis. And when it falls to as low as 5 or 6 meals per minute, the person should be on dialysis.
What's the process for dialysis? One, what does it do in the body? And then for how long can one stay on dialysis? And does it have any complications?
Well, every treatment has complications, but the good thing is that most people who do dialysis have come to get used to that complication. So dialysis is something we offer people whose 2 kidneys have failed. Now, kidney failure can be an acute thing in which the kidneys have a potential of recovering. If a woman is pregnant and she develops very high blood pressure, that blood pressure can damage the kidneys transiently. When she's well taken care of, she's likely to recover fully and she will not need dialysis again. Or if somebody suffers vomiting, diarrhea, and loses so much fluid from the body and suffers acute kidney injury or acute shutdown of the kidneys, well treated with fluids, drugs, and dialysis perhaps, the kidneys will recover. So the person may need just a few sessions of dialysis, or the woman may need just a few sessions of dialysis and recover. So dialysis essentially is what we offer people whose kidneys have failed. So if it's acute kidney injury, the person will recover, like a pregnant woman who undergoes dialysis because she's developed preeclampsia or eclampsia and the kidney function is bad. So what we'll do is that we'll connect them to a machine, and over a period of 3 or 4 hours, the machine is able to remove the wastes that the kidneys will normally remove. So after a few sessions, the kidneys recover function and they're able to do without dialysis. However, if somebody has been known to be hypertensive or diabetic, and those two conditions were not well cared for or managed appropriately, then those two conditions can affect the two kidneys irreversibly in such a way that they will have to be dependent on dialysis for life until they do a kidney transplant, hoping that they are young enough and they don't have other conditions that will make them not survive beyond a transplant, because we need to screen them well to be sure they don't have some cancer or some heart condition that may not improve after the transplant. So we need to really watch out for those things before we ask someone to go on and do a transplant. And in our environment, like I said earlier on, in Nigeria, there are over 10 centers offering transplant. And of course, dialysis is available in probably over 50 centers all over the country. So, but the thing is that if the government is able to help people to access dialysis, it goes a long way in reducing the stress of people not being able to afford it, because it's very expensive. Most places will dialyze a patient, where the ideal dialysis that people should undergo is about 3 times a week. So, and each session costs between 20 and 30,000. So that's looking at about 90 to 100,000 per week. And in a month, you're talking about 400,000. That's excluding the drugs that the patient has to be on. But if the government has able to put a structure in place that reimburses centers that do dialysis, then people can be encouraged to do dialysis and then transit to transplant. In some countries in Africa, dialysis is offered free. Sudan is an example. They've been fighting civil war until recently. They offer their citizens dialysis and transplant. So after the transplant, of course, the person needs to be on medications, just like those who have diabetes and hypertension are on medications. They need to be on anti-rejection medications for a lifetime, usually about 3 drugs. And those drugs are expensive, but it's a far better lifestyle, or it's a far better life than being on dialysis, because dialysis in our environment is in-center. Someone has to go into a hospital, do it 3 times a week, if they can afford that, or once a week. In developed world, where they have home dialysis for their citizens, people can actually dialyze and go to work. So they can do the dialysis in the evening when they come back from work, and they can do it almost on a daily basis, because that has been found with studies to confer a better quality of life than doing 3 times a week dialysis. Because it's like the function of the dialysis, or what it does, is to remove the waste. So it removes the waste on Monday. The person doesn't do dialysis on Tuesday. So those wastes accumulate. The person comes back on Wednesday to do another session, it removes the waste. And then Thursday, the person doesn't do dialysis. But if the person is doing it daily, may do it less than 3 hours, like those that go in to do 4 hours 3 times a week. But it achieves almost what the kidneys do. It mimics what the kidneys do. That's almost out of 5 or 6 days in a week, it can do about 2 or 3 hours of dialysis, and they're able to go about their normal work. You won't even know they're on dialysis, because you see them looking very
Hold
healthy.
the thought, Doc. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us in this remaining moments, we've been talking about kidney. Doc, in this remaining moments, what lifestyles would keep us away from problems with our kidney?
Right. So, well, the first thing is that you should consume less salt. You keep your salt low, so don't use table salt, and also be careful about the seasonings that's used while cooking, because those of them that contain lots of salt, you should cut back on it. So cut back on salt during meals. So blacks have been shown to have a way of not excreting as much salt as the whites. So a white man can eat lots of salt, but a black man eats same. He doesn't excrete as much salt, so ultimately he is at risk of developing hypertension. So that's one, cut back on salt intake. Then take fruits regularly, fruits and vegetables. Do them every day. As you do them, it helps to supply some nutrients that keeps the blood pressure normal. Then people who are hypertensive, they should do their best to be on their medications, keep up with using their medication, and of course see their doctors to be sure that the drugs are controlling the blood pressure. If it's not controlling, they may need to be changed or the dose titrated upwards. And also those who have diabetes should also see their doctors, use their medications, do their lifestyle. That's way they keep their kidneys healthy. And also, I mean, if someone smokes, they should do away with smoking.
But alcohol?
Alcohol doesn't affect the kidneys directly, but if someone consumes alcohol, it can affect the heart, it can cause the blood pressure to go up. So if there's a problem with the heart, the kidneys may be affected with time. And if the blood pressure goes up, then the kidneys may be affected with time. So alcohol is not too good either. Even though people talk about red wine,
being good for the heart.
There's something in red wine that tends to
resveratrol.
Yes, to help the heart. So the other lifestyle, people should avoid using herbal remedies. Herbal remedies that is sold in many motor parks, it's not too healthy. If you need to take some analgesics, yes, you can use some, but don't also indulge in the habit of using analgesics every day and for every flimsy excuse. You need to see your doctor. Yes, you can buy over the counter from time to time, but not a habitual thing to keep. Of course, drinking water is also encouraged, that you drink enough for an environment that is quite hot and humid. You need to drink enough to keep your kidneys working well. And of course, I mean, people who also have other health challenges should make sure that they see their doctors to see if those conditions may affect the kidneys, like HIV, hepatitis, people who are sick-class. And in our environments, I always encourage people to give themselves a birthday gift by doing a hair screen. So you're celebrating your birthday, you're expecting people to greet you on Facebook, on Twitter. Do something for yourself, give yourself a birthday gift, do a whole body check.
Talk us through a process of kidney transplant.
Okay, so kidney transplant is what is offered for those who are on long-term dialysis. So when someone is having to do dialysis for the rest of their life because the two kidneys have failed and they cannot recover, like I talked about, some conditions that the kidneys can recover. So if the kidneys are not able to recover, the person needs to start planning for a transplant. So in places where the government funds dialysis and funds transplant, there's what is called a waiting list. So you're not waiting for someone that is alive to donate to you. So people who die in a hospital setting whose kidneys are working very well, those kidneys can be harvested and given to two people who are on dialysis. That reduces the number on the waiting list. But those are places where the government funds dialysis and transplant. In our environment, what we do is that we ask patients to get a donor who should be related to them, because we are going to screen and make sure that the person's blood group is compatible with the recipient, the person on dialysis. The donor should have the same blood group or should have a blood group O. Then the person who is donating should also not have hypertension or diabetes, should also not have hepatitis B, C, or HIV infection. We also will be sure that the person doesn't have some cysts in the kidneys, like some people do have kidney cysts. And so when we look at all those and we make sure the donor is fine, then we can start saying, okay, let's send the samples to the lab to see how compatible they are. So we'll do what's called HLA typing to see out of about 6 loci how the donor matches the recipient. If they match, very fine. So the blood of the recipient is mixed with that of the donor, and not just mixed. There's what is called human leukocyte antigen, a way of looking at some parts of the blood of the donor to see how it matches. So these are things that everybody has. It determines whether you're able to mount up a response when you are challenged by any infection. So the way the body recognizes infections is because of this HLA. So it's able to elaborate things to fight infections. So anything that is not part of the body fights it. So in that way, if somebody is going to be a donor, the person's tissue should be as much compatible as possible to the recipient. And that's when we are happy that this person is not likely to have a rejection shortly after the transplant. And then the other thing that will be done is to see how the recipient mounts up some immune response also to the donor. to be sure that it doesn't have what is called donor-specific antibodies. So when this is done and we're happy with that, then we can plan the surgery. The surgery is done, the recipient, where the donor, we will take a kidney from the donor and put same day, within a few minutes. So we usually have two teams. A team of doctors are operating on the donor to harvest the one kidney, and another team of doctors will just wait. So just about the time they're bringing out the kidney, which will be put in an ice, and some other chemicals are used to flush it to keep it healthy. It's put in the recipient. So within a period of 30 minutes, that's done. And then the person will start passing urine and will not need dialysis again. But the person has to be on anti-rejection medications for a lifetime.
For a lifetime?
Well, yes, has to be on anti-rejection medications because the body will always mount immunity to anything that is foreign. So to keep the body immune system at bay so it doesn't mount up that immune response, it needs to be on anti-rejection medications. And there are about 3 of them, which also expensive, but on the long run, it's cheaper than dialysis and better quality of life. Because people like women who previously were not seeing their period, as long as they're in their reproductive age, many of them start seeing their period after transplant, and then some can even go ahead and have a pregnancy. In some men that are impotent, some of them also gain or recover their erectile.
Really?
Yeah, the erectile dysfunction is cured. Not always.
I know.
Depends on what the cause of that erectile dysfunction is before the transplant.
Thank you. Thank you very much, Doc. I'm so humbled that you found time to come here
and
to empower us with this information. There'll be fallouts from this, and I hope when I invite you to come and take care of the fallouts, you'll come and you'll honor our invitation.
It's a pleasure, ma'am.
Like they say, health is wealth. And recently they celebrated World Kidney Day. You take care of your kidney, and with the lifestyles that you make, God will help you. There's always a God part and a man part until I come your way another time. You have a wonderful week ahead of you. Goodbye. God bless you, and see you again next week.